Supraventricular Tachycardia. Introduction. The supraventricular tachycardias, or SVTs, represent a category of arrhythmias featuring abnormal rapid but regular heart rhythms with ventricular rate over 100 beats per minute and most present with narrow QRS complex on the EKG. Epidemiology. Most common form of SVT in adults is atrioventricular nodule reentrant reciprocating tachycardia, so AVNRT. Etiology. There are several different types of SVTs, such as atrial tachycardia, atrial flutter, and atrial fibrillation. Most common cause is a reentrant pathway. Pathophysiology. Propagating impulse fails to terminate after normal activation of the myocardium and persists to re-excite the tissue after the refractory period has ended. Group of fibers fail to activate during the initial depolarization phase. Then there's the clinical manifestations. So symptoms can include palpitations, sensation that the heart is racing, chest pain, dyspnea, difficulty breathing, diminished exertion capacity, a syncope, which is like fainting, transient loss of consciousness. Differential diagnoses include sinus tachycardia, atrial tachycardia, sinoatrial nodule reentrant tachycardias, atrial fibrillation, atrial flutter, multifocal atrial tachycardia, and others. So the way you diagnose this is first you want to take a history and a physical exam. You definitely want to look out for things that would be a red flag of a potential arrhythmia, such as palpitations and tachycardia. You'd want to monitor the heart using an EKG,